Welcome to the GoodLocksDocs podcast, where hair restoration surgeons and brothers Dr. Asi Peretz and Dr. Eric Peretz discuss the latest advances in hair transplantation, share their personal experiences, and take a no-holds-barred look into the good, the bad, and the ugly of hair transplantation.
Hello everybody, I'm Dr. Asi Peretz.
And I'm Dr. Eric Peretz.
And welcome back to the second episode of the GoodLocksDocs podcast. Thank you so much for listening to us again. We really appreciate it.
So today we were looking to answer a very common question.
Yes. So what makes a person a good candidate for hair transplant surgery?
Or what we normally get asked is, can anyone get a hair transplant?
Yes.
And I think the truth of the matter is anyone can actually get a hair transplant. You can take some hair from here, you can transplant it here, and you'll have hair.
Yeah, you
can get little blotches on your head. I mean,
you can even take hair from here and transplant it here. You can even take hair from here and transplant it here.
Yeah, so hair will grow, right? Because the scalp is rich in blood supply and it will most likely grow. But we want to get a good, natural, aesthetic result that will complement the patient's appearance.
Yes, because you know what? I mean, and we are advocates of this. Sometimes just shaving your head is actually better than doing a hair transplant surgery.
Yes, if you're not a good candidate, if you're a Norwood 7, you're not a good candidate for hair transplantation.
Yeah, and there's certain things, I mean, it's not over for you. There's certain things you can do to masculinize yourself, but hair transplantation is not going to help everyone aesthetically.
And I think we should do a podcast on that in the future, how to masculinize yourself. But let's get on to the topic itself.
Yes.
So what makes someone a good candidate?
Okay, so I think let's break it up into two different categories. We'll do men and women.
Yes.
Okay, so let's start off with men, because it's what we deal with the most.
Yes. So for a man, I think it's quite simple to know whether he's experiencing male pattern baldness or another cause of baldness.
Yes.
And so for that reason, we don't generally do too much investigations into it.
Yeah, so the diagnosis is quite easy for a man.
Yeah.
So once we get the diagnosis, okay, now how do we say, okay, he's a good candidate or not so much, shave your head?
Okay, so I think what we would do is, firstly we look into their family history, right? Does your father, does your grandfather on your mother's side have hair? And we assess from there, is there early hair loss in your family?
Yes. So I would argue that even before a family history, we would just simply look at the donor area, which is the side hairs that are generally left in a bald person versus the top area, okay, which is the bald area.
Yes.
So the donor area to bald area ratio, if you have more donor area than bald area, you're a better candidate or a good candidate. Mm-hmm. If you have a greater bald area and less donor area, you would be a bad candidate.
Yes, and there's a scale for that, right? There's the Norwood scale that we talk about. It goes from 1 to 7, and sometimes we even call people Norwood 8s, and those are people who have almost no donor area and a lot of bald head. Those ones should just shave it off.
That's true. If you're a Norwood 7 or 8, you should probably just bite the bullet and shave your hair.
Agreed.
I think I've never heard a hair transplant surgeon say that, but I'm going to say it.
Okay, so right now, what makes a good donor area?
I'll do it. So donor area. So firstly, maybe we should discuss why these hairs remain while these hairs on top do not. And it's a genetic predisposition of the hairs to the actions of dihydrotestosterone, okay, which is the most potent form of testosterone.
Yes.
So testosterone is converted to dihydrotestosterone, and then these genetically prone hairs miniaturize under dihydrotestosterone's action. And for most of these most of these genetically prone hairs are actually found in that distribution on the top of the head and not on the sides of the head. So any hair that we take from the sides that isn't genetically prone, we can transplant onto the scalp, and it would retain its characteristics as not genetically prone to the actions of dihydrotestosterone.
And that's also why finasteride works, right? Because
Yes.
it blocks the conversion to DHT.
Yes.
And thereby stopping the hairs from miniaturizing and falling out.
Exactly.
Mm-hmm.
Yeah.
So let's talk about women.
Okay.
Yeah.
Okay. Oh, another thing. Before we talk about women, another thing that might make you a good candidate for hair transplant surgery or a bad candidate is the size of your actual head.
Sure, right? If there's more surface area, you got more to cover. You need more hair to cover.
Yes.
So if your head's really big and shiny and you're a Norwood 6 or 7, you're probably not a good candidate.
Yeah. But, we can always assess. Because I've actually seen a couple of Norwood 6s, 7s that have such thick donor area still. We can still create, some sort of a natural looking hairline for them.
And that would actually give you a nice frame to your head. Some people don't actually mind if the back is open, as long as you can frame their face nicely with the hairline.
Yes, I think most people don't mind. I mean, no one really sees the back of your head, and when you're talking to people, they talk to you face on, and when you have all of this open, it draws their attention away from your eyes. So you want to frame to the face, and that's what the hairline does for us.
Yes. Okay. So let's talk about women, right? With women, it's quite. I don't think we'll get too much into it.
Yeah.
Maybe for another day, but for women, we need to do an array of tests before we even consider transplantation.
Yes. We need to exclude any general medical condition that can lead to hair loss in women, and there are quite a few of them actually.
Yeah. It's not as easy to tell with women as it is with men.
Yes, exactly. So we need to do a whole bunch of tests, and even then, we'll always try to help a woman who's losing her hair, even with transplantation, but we can never really guarantee results for them.
That is true, because a lot of the time it's quite generally distributed hair loss.
So it's not like in a man where you hair from the sides that isn't prone to miniaturization and putting it on top. In a woman, it's hard to pick those areas where the hair wouldn't be prone to miniaturization.
Exactly.
But what I will say, what I do love doing for women is
PRP. I think PRP, PRF works really well in female pattern baldness.
I think so too.
And in fact, better than in men, in my experience. And I think they respond well to minoxidil.
Yes.
And so before doing any of that, I think they should always try a less invasive approach.
For sure.
Yeah.
Yeah. But what I was actually going to say is what I really love doing for women is forehead reduction with hair transplantation. So so the woman already has fantastic hair, beautiful hair, but she may have a forehead that's not in proportion with the rest of her face.
Yes, a lot of women actually have quite a large forehead, which makes them appear slightly less feminine.
Yes.
And when you sort of frame their face at a lower hairline, it gives them a lot more feminine appearance.
Let's not forget the thirds of the face. So to be exactly proportional, you want to have from the bottom of your nose to your chin, from here to about your mid eyebrow, from your mid eyebrow to your hairline should be equal distances. Now, no one's perfect in nature, but roughly equal. And if your forehead is quite pronounced, that sort of golden ratio changes.
Yeah.
Definitely. Yeah, and I mean, people are going to extremes to correct this, doing forehead reduction surgery.
By actually cutting out some skin and then stitching it together.
I think
So,
it's crazy.
That's crazy. Yeah.
I think totally unnecessary. You can get
a transplant there, and within a few months to a year, you can have a really good result.
natural results.
Yeah.
So I love doing that.
Yeah.
But
But with any females looking to do, or any females suffering from hair loss, I think if you have no medical illnesses and you're looking for a different approach, I really think that PRF and minoxidil work really well.
I agree.
And try that before getting a hair transplant.
And a thorough medical investigation first.
Absolutely.
So first things first, investigation,
Yes.
then those
See a
treatments.
dermatologist, perhaps get them to look at your head with a trichoscope.
Or one of us.
Yeah.
We'd be happy to help.
Cool.
But thank you guys.
Yeah,
If
I
you've
think
been,
that's long enough.
yeah. If you've enjoyed this, please follow us, Instagram.
Subscribe to our YouTube channel,
Yeah.
and we'll hopefully be doing one of these every week.
And ask us questions. It really helps us with this content, so we know what you're interested in and what we can discuss.
Yeah. Cool.
Okay. Bye, Brian.
Bye.
Bye.